Yeah, so he does. I mean, most people do have an overbite of words.
Right. Would you like to invite the other consultation to show it to watch?
Well, I don't know if are you okay if another person's here? That's
not
not something
like
typically. Yeah, I think he wants. Yeah, so. Okay, so first of all, thank you. We were just talking you up quite a bit because I was just saying how you're like got the best temperament. I need to be around you more because I'm not as laid back and chill. I'm on. People love me because I'm transparent, but like what makes me good is that I am uptight a lot of times. Like I want things perfect. Like I hate when things don't go right. Like today's been a little bit more stressful than I anticipated. On the schedule, it looked perfect, but then there's been some collisions. There was a consultation between this little interaction, like, oh, I got to see that next time so I don't do it to myself again, you know? But anyways, so you're welcome here anytime because that chillness would work great with me.
Okay.
That's what got me here. I was in my pool swimming when he's like, you got to come down here. I'm like, I'm in the pool.
Thank you though, because this is a moment that you, again, these are just temporaries we're going to show you.
Sure.
But I love it because it gives you a chance to be able to see him in a new light. And I like it. I'm happy with where we're at now. That said, you're not going to hurt my feelings if you're like, you know what, we're headed northwest and we want to go north. Right? Because when we talked last time, he was so great because he was just like, I trust you. So, and so
I'm like nitpicking. Like,
yeah,
no.
You're the other side of the equation where it's like,
did you choose what color? No. I said, what? Because like these are temporaries. I'm like, I chose my colors.
Yeah.
Well,
the great thing is you'll be in this for just a few months, and then we come back to the drawing board. And if for some reason I'm pointing just like northwest, like I could hit any target as long as I can see it. This is how I envisioned them at first, and I like where they're at. Initially this morning when I put them, like last night when we ended the surgery, I actually did a little trying on them, and I made a bunch of modifications between last night and this morning. Just so you know, like we were working pretty hard. Like I came in and I was modifying right up until the second you came. Yeah. And so, but I'm happy with kind of where they're at right now. And but okay, so let's answer some of the big questions here. Where are you at on a scale of 1 to 10? On a scale of 1 to 10 as far as pain.
0.
That's impossible. What are you talking about? I'm being facetious, but isn't that amazing? Like we took all your teeth out and you're a 0. You're not a liar, right?
Yeah, no, I can feel it a tiny bit if I press on it, but
you're good.
Yeah.
Now I noticed when I was putting the device in, it was a little tight for a minute, right?
Yeah.
So that was one part where it's like I had to kind of back off because I was excited and like turning the thumbs. Like okay, hold on, slow down. So we did a little bit slower, slower.
But I think that might have to do with it getting up towards my sinuses.
Yeah.
Because the bottom one's piece of cake.
Yep. Okay, good, awesome. So 0 out of 10. What was it scary coming in? Like, what was the hardest part on surgery day? Because it's only been 24 hours, right?
Right. I don't know. I've had a couple surgeries, so it's like it doesn't like scare me or faze me.
You had one question about last night. You're saying, "Is this normal?" And that you were bleeding a little bit, and you're like, "Is this okay?" And I said, "Nope, totally normal. Your body's just kind of cleansing itself." It's
well, and see, I was stressed out because someone had told me only 2 hours of bleeding, and if it's any more than that, there's a problem. And I'm like, that's a lot more bleeding.
Yeah.
Than I was told.
Yeah. Well, and this is
and that's probably why he asked.
Yes.
And if he had perfectly good health, but I mean, as far as his teeth, there was infection under there, right? That's one of the reasons why we chose to do this. And so when the body does have infection, the way it kind of just pushes and cleanses itself is it bleeds. But today, aside from a tiny bit here and there, like when we put the teeth on, no blood, right?
No.
Yeah. So I know some people will still bleed today too, and that's still not that uncommon. So, okay. So do you want to see your teeth?
Yes.
Okay. So what we're gonna do is let's see, get here in the middle. Let's get in. Okay. Let's see, and let's go up a little bit higher. A little higher. Oh. That'll work. Okay. So I'm gonna put this here. Oh, before we do this though, this is something I always do. So I'm gonna have you turn, and I'm gonna have you go ahead and take off your mask and show them first. Okay.
Oh wow.
He looks a little different, doesn't he?
Yeah, quite a bit.
Mm-hmm.
Quite a bit.
Mhm.
Okay. All right. There you go. Go ahead and turn in, and you go ahead and lift that up, and you can see.
Oh wow.
See
That's really
teeth.
good. Yeah.
What's your first impressions?
I like it.
You're not gonna hurt my feelings. It's
No,
okay.
no, I like it a lot.
This is version for Dr. Hendricks number
Mhm.
1, right?
Yeah.
What do you notice different?
Well, it's like you can, like you'd mentioned it earlier, but when I talk, you can actually see my teeth
Yes.
as I'm talking, and
Right. That's why I've never seen that.
She said she'd never seen this picture before. I was like, really? Okay.
No, I'm pretty good at hiding it.
Yeah, man. You're a stud.
Mm-hmm.
Okay, so if you turn that way, I'll show you what it looks like side by side. Okay, so we'll go here. So side by side. Oh, sorry, that's after.
Mhm.
And here's a side by side.
Yeah. Wow.
So quite a bit
Can you give
different,
an actual
right?
Smile.
Now,
There you go.
notice like where the nose is or the chin's at. Do you see how I lengthened your face a little bit? So
Mhm.
before, when you had these teeth here,
Mhm.
I actually took your incisal edge down about 4 to 5 millimeters,
Okay.
which brought your chin down a little bit too. You'll notice in this picture, the next one, a little bit better what that is like. So again, from here to here versus here to here, do you see the difference?
Yeah.
Interesting.
It's just a little bit longer. It gives you, like, to me, this looks like more, you look younger here.
Mm-hmm.
And to me, again, and this may not be true, but in my mind,
Yeah.
you look more symmetrical, more proportional. From like, if you look at your different thirds of your, this portion I like. I think that you getting used to your smile, that'll come with time.
Mm-hmm. Yeah.
Most of the time when patients get new teeth, they kind of pull down in the lower because they're not used to it. They've been hiding. My dad, I did his surgery a few weeks ago, and he still is so awkward. He still pulls his teeth down. I'm hoping he'll normalize. But normally, when you've been hiding it for a while, typically you pull down a little bit more on the lower, and that's why in this picture I feel like you don't actually. If you notice when you've been talking, you don't show as much teeth as you do in this picture. Let me see if I get over here. Come on. This mouse is just go. So I think that your lips pulling down a little bit more here than it actually is really real. But we'll see, because I don't necessarily want to show this much lower teeth.
Okay.
But I think again, it's the factor that it's just so new.
Mm-hmm.
I like the upper display. That's just me. Again, Dr. Hendricks, but that doesn't mean that we can't change it, right?
Right.
So, questions, thoughts, concerns. Be brutal on me. I'm okay. I'm a tough guy. Any thoughts right now?
No, it's pretty good. Feels a little bit cramped on the inside.
Yes. Why?
It definitely sounds like
Different.
Well, yeah, and like I told him when I was talking to him on the phone, I was like, "Hey, wait, this it sounds like your mouth isn't big enough for the teeth that are in there."
Yes, and if you think back on like where you started, you had teeth in the front, but not in the back. So your tongue actually, when you don't have teeth, it actually your tongue expands.
Mm-hmm.
It's like a muscle, and so if there's room, it's going to actually take up the room, and so that will your tongue will actually start to shrink back down.
Okay.
So kind of funny how that works. So right now that when people don't have teeth in the back, your tongue's going to feel cramped. Be careful because as you chew and eat, and again, not that you're going to chew, you don't do that, right? Not now.
Nope.
But as you bite down, because biting is different than chewing. Biting means you're going up and down. I'm okay with you biting. Okay, biting up and down, that's not bad. It's the action of like a cow when you bite down and you slide. That action is what we want to avoid.
Mm-hmm.
Okay, so there's still a lot of foods you can eat. Yeah. Okay. Questions? Your bites feels way different, right?
Yeah.
And I don't know where. So when you sat down and you bit down the first time, like I was chasing the bite a little bit. I'm like, where the heck does he want to go with this?
Mm-hmm.
But when you relaxed and your jaw came back, that's where I think that's where you want to be. So I think I nailed it where it's supposed to be. But in 4 months, you'll know exactly where it needs to be. Okay. And if it's not where we put it, we'll know for sure. It's just that your bite was so collapsed and forward, like your whole chin. So when you lose teeth in the back, your chin comes forward. So for women, they hate it because they get pointy chins. And when they comes forward, it also goes up. And so now you have someone that has more of a long face, but when it goes forward, it goes up. So now the face goes from long to square, which in other words could be fat.
Right.
And you're like, I'm the same weight. Why do I just look fatter? Well, it's because the chin literally has collapsed on itself. And not only do you look fatter, but your chin's moved out. So now you just look older. And so I mean, you don't see these things yet, but once the swelling goes down, personally, I like the subtle changes we made. But I promise you, I don't care. All I care about is that you get your dream smile. And if not you, her, she'll tell me. I already know this gal enough that she's like, I'll tell you, don't worry. Right? You got my back, right?
I do not hold back.
Good.
I thought they were gonna say,
And that's why you guys are a good couple.
Yeah.
Oh no. No.
Also, it's gonna be really bulky. The device.
Yeah. So this is much bulkier than the final. Because we have material that's not final materials. The final material is going to be that strong zirconia.
Yeah.
And we can make it so thin. This one relies on a little bit of bulk. So just the time you're getting used to talking and speaking, I'm going to give you a new one. You're going to go, well, thanks a lot. Now I have to learn again. But it'll be a lot easier the second time.
Okay.
Questions?
Let's see here.
The sutures are going to fall out.
Yes. Okay.
Bring some scissors with you guys. Okay. So if you have a suture that basically starts to drive you crazy, it's going down your throat, not a big deal. Just wipe the scissors down, go back there and just cut it out.
Okay.
Not a big deal. The other thing too is as far as diet, do you have questions on that at all? I know that you're really worried about it.
No, we'll be
I'm
good
more
there.
worried than he is because of the diet restrictions.
Yeah, I mean, I have a bunch of food allergies, but
Okay.
but I'll deal with it.
Okay.
No, can I sleep laying down yet?
Right.
Tonight, no.
Okay.
Tomorrow night, yes.
Okay.
If you wanted to be super careful, 2 nights.
Okay.
But usually most swelling and inflammation peaks at 48 hours.
Mhm.
By 72, you're just fine. So, but if you can do one more night, I think you'll really appreciate it. This fact that you're at a 0, that's amazing. Let's stay there.
Mhm.
How do we stay there? We make sure we manage our medications by the clock.
Yep.
Not waiting until it starts to hurt. For
Oh,
us
yes.
guys,
Mhm.
I don't know, maybe you're a lot better than me, but I'm the type of guy that's so easy to forget now.
So my first surgery, I was like that, where I was like, "Oh, this doesn't hurt," blah 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 blah. Then all of a sudden, boom! And ever since then, I take it like by the schedule.
Cool.
Yeah.
Cool. No, so just make sure you stay up every 4 hours. 2 ibuprofen, 1 Tylenol. The narcotics only take is if you need it, and if you do, remember the narcotics do not have Tylenol in it.
Mhm.
I do that purposely because then you don't have to take it, and I don't want to hurt your kidneys or your liver. So
yeah.
Okay, but if you do it by the clock, you could be on this regimen for a week and be just fine.
Okay.
And if you want to be more a little more careful because you're gonna get in a plane, right?
Yep.
Right. Yeah, you're gonna be elevation is gonna change, and just the elevation change could cause a little bit of discomfort. Definitely make sure you stay on that. Matter of fact, let's do one more round of. I'm gonna send another. So I'm gonna give you a script for one more round of antibiotics and a round for steroids, just in case. I want to give you everything that you don't have to go to some Mexican pharmacy. I have nothing against Mexico, just I'm saying. But at the end of the day, I just want to make sure that you're in good hands because you're going on a cruise, right?
No, we're just going down to Cabo and hang out at a resort.
I thought you were going on a cruise.
Not yet.
Okay.
One of these days.
Cabo's good. There's awesome, but let's get you a couple things just in case.
Okay.
Other questions?
Do you think there's a chance that we get the permanence in before Thanksgiving?
Okay, so Thanksgiving what's the date on that?
November.
Yeah, so
like
we're in July. We're still in July.
Barely, yeah.
August, September,
It'll be the
October,
26th,
November. So
25th.
it's basically 4 months. So typically, okay. So here's the thing is, if let's do this, let's schedule you in 3.5 months.
Okay.
And as long as we don't have to do like a lot of big changes, then I think there's a really good chance we could have you in your finals. Meaning, like if your smile is like, I love it, minor changes, but if we have to go through like a couple try-ins to get it just right, it might be hard to do that by Thanksgiving. But if
Sure.
we're super close, then I think that wouldn't be difficult. We're basically doing final calculations, and then the next visit would be your finals.
Okay.
All I need is literally a signature that says, I love these, and I want you to go to finals. Because if I don't get the signature, I always want it because people are crazy.
Mhm.
I mean, that sometimes they're like, hey, I love them, but, could you just move this whole tooth in? I'm like, no. Because when we go to the final material, we can't change them, right? So you're
Yeah.
going to become a closet dentist.
Okay.
It's okay. You're going to look at everyone's teeth,
Mhm.
and you're going to be super, super picky. And so you're going to have so much more clarity next time I see you.
Yeah.
Think about like, I'm going to give you a sheet. I'll send it to you, but it's the questions that I ask. It's like midline, can't, all these things that I'm filtering every conversation through. Like every time you're talking, I'm looking, going, is that right? Does that look good? It'll give you like a way to look at your smile so that you can get clear about it. Shape, size, shade, right? How much you display when you talk. You're going to start to watch your wife or your girlfriend talk. and I knew I was going to do that.
Yep.
I told you
It's
that.
all good.
But you're going to watch people talk. You'll notice how much they display when they're talking.
Mhm.
And that'll be really, like right now when you're talking, I'm watching, I can see your lower, I can see a little bit your upper, but you are swollen, and so your lip's not moving as much. It's going to change, and that's why we take pictures.
Okay.
Because in 4 months you're going to be a completely different person. You're going to completely open up. Your smile is going to be way different.
Mhm.
Hopefully it's awesome, but if it's not, that's why we wait 4 months.
It's already better than it was. So,
Yeah.
I mean,
look at
that
that. That's side by side, you don't even look like the same person. It's incredible. So, other questions?
I don't think I have any more.
Do you have questions? The biggest, so if I were you and I knew what I know, what questions would I have? My biggest thing would be timeline, because it sounds like that's important to you. It's
not super important, but since we're right around that holiday.
So I'd ask the question.
Yeah.
So the question that I would ask would be, what can I do to make it go as streamlined as possible when I come back? And here's my response. It would be, write down your thoughts and your questions in a book, because you may ask a question that makes no sense to me, but if you write it down and you send it to me before you get here, I'll have it. Does that make sense?
Yep.
Hey, Doc, remember that text message? So you can send text to our actual software. Doc, these are the questions I have for you, so that when Dr. Hendricks is getting prepared for the conversation we're going to have, I can sit down and try to make sense of it, so that I already have a plan in place before you even get here. Does that kind of make sense?
Yep.
So if you have any questions, that text number, have I given that yet?
I don't know.
Okay. Well, so I'll text it to you.
Okay.
Matter of fact, here we'll do a dry run right now, just so I can see. So this number that I'm going to send you is our text. It basically literally goes right into your chart. So if you want to ask me a question, I'm great at texting. And let's see, that's not you. Let's get back. So if you come in right here, I'm going to text you this. This is the number. And this is the number. Just save this number here.
Okay.
And that's the one that, like, if you have questions and say, hey, this is just a question for Doc when I come in. And that way, the more questions like, hey, I want to have teeth that are longer in the front, or this, or anything, like, the clearer that you are, the easier it is going to be for me to get you to where you want to be. Okay. Even examples, like if you see a picture of someone and you're like, I want my teeth to look a little bit more like theirs, take a picture, send it to us. Okay. Other questions? What other questions would I ask?
Yeah. Just a random question.
Yeah,
Why
man.
are we on YouTube Live? Just out of curiosity.
Because he signed a marketing agreement so that we could share the story.
Yeah.
Ah,
Yeah, man. This is
We
live.
are
It's just going for
informed.
it.
Yep.
I see how it is.
We didn't know.
Oh, you didn't know?
Nope.
Surprise!
We're gonna be famous.
I guess.
Well, I'm sorry. I probably should ask before you walked in.
Yeah.
Other questions? That should be in that caretaker consent. We probably should add that. No, I just want you to know that I really appreciate it. I think the surgery went amazing. Do you want to see your surgery?
Sure.
Let me pull it up real quick for you. It's right here. It is right there. So, and here, now that we have that, let me just log off of this. We're pretty much done here. And okay, so